Running does not cause osteoarthritis. Today we are going to reveal the relationship between running and osteoarthritis and how running can actually help your osteoarthritis. We're also going to show you how to do this safely if you do currently have osteoarthritis. And you'll discover the one thing that you have to add into your training that is going to make the world of difference if you currently have osteoarthritis.
Okay, so what is osteoarthritis? Osteoarthritis is the most common form of arthritis, and it is characterized by the wearing down of cartilage in between the joints. So cartilage is the tissue that protects the bones in the joints. So when that wears down, you end up getting the grinding of bone tissue on each other. So the main symptoms of osteoarthritis are pain, swelling, stiffness, inflammation, and reduced range of motion. It can affect any joint, but the most affected joints are our hands, knees, and hips.
Now that you know what it is, let's talk about what you shouldn't do if you're suffering from osteoarthritis. Osteoarthritis is going to worsen over time from things like running that are high impact. However, that osteoarthritis is going to accelerate even faster if we do no exercise, because keeping the joints moving and keeping the joints lubricated is an important part of treating osteoarthritis. In the early diagnosis of osteoarthritis, it doesn't mean that you have to stop running, but you do need to modify the way that you run, the amount that you run, the frequency that you run, and the intensity that you run at. So you will have to bring in more cross training. You will have to reduce the number of days a week that you train. And really a lot of osteoarthritis is around playing with it and seeing how you go. So you're going to follow the treatment plan that the doctor gives you. You need to follow the strength training exercises that either the physiotherapist or a physical therapist are going to give to you. And then within there's going to be a line of discomfort which is not just tolerable. That's not where we want to go to. Is we don't want to just make the exercise tolerable. There will be a frequency and a volume of training that you'll actually be able to tolerate and have that osteoarthritis feeling better and not worse.
We often get asked the question, does running make your osteoarthritis worse? The short answer is no. There have actually been a few studies out that show running, consistent running, and light running does have benefits on cartilage recovery and adaptation. It is, however, important that we are monitoring the dose-response relationship. What do I mean by that? Dose being how much load, so are we adjusting our load adequately, so lightening the intensity of the runs, how long the runs are, the volume of running, as well as what response that has on your osteoarthritis. If there's not too much negative effect, you can probably up the volume slightly. Naturally, if there is a negative effect, you want to tap off on that dosage, so lower the volume, lower the intensity of the running. That being said though, as I mentioned, the consistency of light running really has shown benefit in bone joint health as well. So we are advocates for running with osteoarthritis. However, as I said, it is just important that you adapt your training load and intensity for you specifically. So how you are responding to that training and making sure that you are taking that into account.
The biggest aspects that you have to focus on if you currently have OA or if you're looking to prevent getting osteoarthritis is strength, nutrition, and consistency. And Devin and Tutu are going to cover those in a lot more detail a little bit later on. The third aspect there is consistency, because if you're not doing this all consistently, you're going to be haphazard and your body's not going to get the response that you're looking for in order to keep your bones strong and healthy. Your bone health is changing dramatically as you're aging, and so that rapid loss of bone health is constantly happening. And so if you're not consistent with your strength training or your nutrition, what's going to be happening is that you're not going to be counteracting that bone health or that bone loss as quickly as you should be. So every time you do a little bit to manage that bone loss and you're not consistent, it's going to reduce dramatically again. So you have to ensure that you're keeping consistent so that you're counteracting that bone health loss much quicker than it's being lost.
So as Devin mentioned earlier, running does not make osteoarthritis worse. And in fact, it actually may be beneficial. And studies show that there are very good results from people with osteoarthritis who continue to run. But when you have your diagnosis, it's important to work with your doctor in terms of when you can return to running. You might have some symptoms mentioned like the swelling and the inflammation that might need to be brought down with medication and a little bit of rest. But once those have been managed enough, you should be able to run. And as we said, a lot of studies show that running is actually beneficial. Physical activity is a very important part of managing osteoarthritis, so you need to get moving, and part of that movement includes running. You can also do other low impact activities like aqua jogging and walking, as well as other activities like yoga for flexibility. But all of this has to be done as well along with strength training, which I'll be touching on later, because strength training is a very, very important part of managing osteoarthritis.
The big question, of course, is osteoarthritis reversible? The short answer to that is no. However, there are things we can do that will really slow down the progression of the osteoarthritis. If you diagnose the osteoarthritis early enough, then you can reverse some of those symptoms. You can't cure osteoarthritis, but by taking certain supplements like L-glutamine and by removing the stimulus, you can allow some healing to take place on those articular surfaces. And then by doing your strength training and ensuring that the bones move over each other in the way that they are supposed to, you can prevent further damage to those articular surfaces and really slow down the progression of osteoarthritis over time, while gradually reintroducing running while you are doing things like cycling and aqua jogging and elliptical, essentially anything that is non-impact exercise. If you follow these things, you can really prolong your quality of life before you potentially need to have a knee replacement at some point in time.
Another thing we want to look at is nutrition. What impact does nutrition have on osteoarthritis? Now, the evidence isn't very clear and there's a lot of different sort of theories around this. There is, however, some evidence to support the intake of calcium and protein to help osteoarthritis symptoms. It is, however, important to note your body can only handle and absorb a certain amount of calcium. So very often we'll take calcium supplements, we'll be taking in as much as we can, but the body can only absorb and utilize a certain amount, and we pass the rest of that. So it can also become quite a, I won't say pointless, but an expensive exercise when we start talking supplementation and taking in too much. So we will only use a certain amount. It is advisable to also check with a nutritionist or a doctor just to make sure that you are getting the dosage right, and to actually check whether it is necessary for you based on what your natural sort of balanced diet is anyway. It is also key that we focus on pre and post fueling for running, and in particular in female athletes. Pre, obviously, eating well and fueling for your training sessions before that training session, and then making sure we are taking in some protein after the training sessions to really try and prioritize that protein synthesis as well, and making sure we are recovering well enough after those training sessions. There has been some evidence to suggest we should also be staying away from inflammatory foods. Inflammatory foods being things like alcohol, deep fried fatty foods, and refined sugars. Those are all things that cause inflammation in and around joints and is going to have a negative effect on your osteoarthritis.
So who does osteoarthritis affect? It can affect adults of any age, but of course there is a greater risk with older adults, particularly adults that are over the age of 50. There's also a gender bias with osteoarthritis, and it does affect more women than men. In the US, for example, in adults over 60, 13% of women are affected and 10% of men are affected. So it's a very slight bias, but it does exist. And also individuals who've had prior joint injuries, and injuries that are going to affect those regions around the joints with the cartilage where you are going to start getting osteoarthritis, those individuals are going to be affected a lot more. And lastly, there seems to be a genetic basis where if family members have had osteoarthritis before, the individual is more likely to get it.
What puts you at risk of osteoarthritis? The main thing is genetics, right? If you have a genetic predisposition towards poor bone health, or your parents struggled with osteoarthritis, chances are that is going to be in your lineage, and that's you have to put things in place to help prevent that. Things like prepubescent nutrition or poor nutrition is definitely going to have an impact on osteoarthritis, and definitely inactivity. So if you are not active, that is going to play a massive role within the risk factors for osteoarthritis.
Just because you've got osteoarthritis doesn't mean that you stop having running goals. So you can still train towards running goals, but we have to change the way that you do things. And the most important two things that you are going to need to introduce and do differently is that you must do strength training and you must add cross training, either in the form of something like cycling or the elliptigo, or aqua jogging is a great form of cross training, because we do need to reduce the number of times you run in a week. So typically in this sector of the population, we would advocate for a maximum of 4 runs a week. Once you've been diagnosed with osteoarthritis, I would recommend running 3 days a week and then adding in either a day of cycling and aqua jogging. And by doing that, you're still going to maintain the kind of fitness that you're going to require to achieve the goals that you want to on race day. And then critically, you have to do strength training. If you're not doing that already, then for osteoarthritis it is a non-negotiable, because by fixing that part, you are really helping your body to deal much better with how your joints function, and that is going to make an enormous difference to the amount of discomfort that you feel from osteoarthritis.
As I mentioned previously, strength training is very important in the management of osteoarthritis. And we also know that muscle weakness is a common feature in adults with osteoarthritis. We can't say for certain if the muscle weakness is a cause of osteoarthritis or if it's a result of it, but what we can say for sure is that it is there. So research has shown that for adults with osteoarthritis, strength training is going to be very important in relieving both the pain and the swelling that is associated with the disease. And the important thing is that long-term adherence to a strength training regimen is important for it to be successful.
It's all good and well knowing this. The key factor here is really how you implement it into your training. That's going to make the world of difference. We are hosting a free masterclass called Foster Beyond 50 that is going to show you exactly how to do this. You can book your seat by clicking on the screen now.